Soy Esther Nieto, presidenta del 13º Congreso de FAECAP, segundo de Acalefic. Este año tenemos el lema Evolución de la enfermera familiar y comunitaria, pieza clave de la atención primaria. Y para ir abriendo boca a este congreso, os presentamos algo muy especial, una conferencia de Margrieta Langins, asesora de enfermería y matronas para la OMS Europa. Nos va a hablar de cuál es el papel que tienen las enfermeras familiares y comunitarias en la atención primaria, cuál es su perspectiva y cómo lo ve de la importancia que es la enfermería dentro de la atención primaria. Esperamos que os guste y que sea una pieza para empezar el congreso. Saludos, nos vemos en Burgos.
Good morning, colleagues. It gives me great pleasure to greet you. I'm not sure when this will reach you, in the morning, in the afternoon, or in the evening, but my name is Margrieta Langins, and I am the Nursing and Midwifery Policy Advisor here at the WHO Regional Office for Europe. Today, I would like to talk to you about the role of nursing in primary health care and the vital role that nurses play in strengthening health systems in your country, but also globally. Nurses really are the backbone of our health workforce, but also of primary health care, as they deliver holistic, patient-centered care in communities, homes, and clinics. They expand access, they can manage chronic conditions, they promote disease prevention, and coordinate care, especially in regions facing health workforce shortages. We see that nurses are sometimes those last health workers in the communities that need them most. Strengthening the role, therefore, of nurses in primary health care is not only important as a health systems priority, but it improves quality, efficiency, and population health for our patients and our communities. These are the faces of our patients. We have Georgi in Bulgaria, who has schizophrenia, and he has been reintegrated into the community. He will need, in the primary healthcare setting, support for him to adjust after being in an institution for 20 years, to be able to get a job, to integrate into the community, and to keep on top of his medications, adjust them as needed, and make sure that he is taking them regularly. Or we have Maria holding her grandson, who has diabetes, and her daughter is working and cannot be there on a day-to-day basis. And so Maria, who is aging and has her own complex condition, needs to be able to rely on a primary healthcare system that can that can be close to her, that can be in her community, so she doesn't need to travel to a specialist, especially when her diabetes is stable and manageable in the community. Or we have little Arkady, who has an attention deficiency disorder that was recognized from when he was a little boy. And we want Arkady to thrive. We want, with the latest behavioral methodologies and with the latest medicines, to be able to keep him integrated as soon as possible within his circle of friends at school and get those supports he needs at school to help him keep up with the curricula. Or we have Olive, who is trying to take care of her husband who has dementia. And she herself, as you see from the picture, is very old and has the propensity to fall, to experience fractures if she falls. And that would ruin everything for their unit as they try to stay at home, or they try to stay as close to home as possible. So the recent European Health Report was just published, and it reinforces this message very clearly. Our health systems need to evolve to meet growing and complex challenges. This report that was just launched last month highlights critical threats that we are facing to our societies. Non-communicable diseases and mental health those results have shown that 1 in 6 people in Europe dies prematurely from non-communicable diseases, and mental health conditions are rising, particularly among young people. So primary healthcare nurses can play a vital role in early detection, chronic disease management, and mental health support, helping to reduce hospitalizations and improve long-term health outcomes. Or when it comes to demographic shifts and aging populations, Europe's population is aging very rapidly. And just last year, we passed a point at which we have more people older than 55 in the European region than younger. So the increasing demand for home-based services, chronic disease management, long-term care is very clear in our region. And primary healthcare nurses are key to healthy aging strategies, supporting older people in the community to remain independent while reducing the burden on hospitals and emergency services. Or when it comes to climate change and health security, extreme weather, air pollution, infectious diseases, outbreaks are becoming more frequent. They're causing ailments to our societies, to our communities. Primary healthcare nurses at the forefront can be educating communities, implementing preventative measures, and ensuring healthcare remains accessible during crisis, but also find solutions in which making our health systems more environmentally friendly. The report underscores the urgent need for stronger investment in primary healthcare nursing to ensure health systems remain resilient, sustainable, and equitable. Without well-trained, well-supported nurses in primary care, our ability to tackle these emerging threats will be severely limited. And here I've brought up this slide and these numbers just to convey that the quality of care gap is a silent crisis. It's contributing to between 5.7 and 8.4 million deaths annually. So that's more than all the deaths globally caused by HIV, tuberculosis, and malaria combined. And this is not an issue of us not knowing what to do. That quality of care gap is a silent crisis because our systems are not able to release the manpower, to equip the manpower, to educate the manpower, to keep up with and to increase the numbers of that manpower, to be able to early detect, expand access, reduce preventable errors, provide health education or self-management support, and coordinate. So it's not that we don't know what to do, it's that we cannot achieve what we need to do, and that as a result, we are duplicating care, we are missing care, we are delaying care. So this brings into sharp focus really, the primary healthcare and the workforce challenges. And I just want to highlight some key global milestones that have shaped the health agenda in the UN, in WHO, and particularly the role of health workforce in advancing sustainable development goals, right, and universal health coverage. These frameworks over the past years have consistently underscored the critical role of workforce, of which nurses and midwives are upwards of 60% in achieving health equity and strengthening primary healthcare systems. And so we've had in 2015 the 2030 Agenda for Sustainable Development, and this confirmed the importance of health workforce density and distribution. Then we had in 2016 the Global Health Strategy. In 2018, when we had the Astana Declaration to strive for retention and availability of primary health care, again, we reinforced rural, remote, and less developed areas really receiving the health workforce that it needs. In 2019, the WHO and UN agencies made the political declaration on the high level meeting on universal health coverage to really scale up efforts on improving availability of rural health workers. And just recently in 2023, we had the Health and Care Workforce Time to Act framework for action that was endorsed by all 53 countries in the WHO European region. So again and again, the UN, the World Health Organization have been working with member states to really bring to focus through declarations, through strategies, through important evidence-based reports, the importance of this workforce, the importance of primary health care, and the importance of both of these to the strategic development. And here's just a photo from our most recent developments at the 73rd session of the Regional Committee for Europe, where Dr. Hans Kluge, where Dr. Natasha Azopardi-Muscat, and my head of unit, Dr. Tomas Zapata, really got the support from all 53 member states to really invest in the health workforce. Primary health care is not just one part of the health system. It is the foundation that determines how well a system functions. And these graphs are interesting that show really how a strong primary healthcare system can improve health outcomes, financial protection, and equity, making it essential to achieving universal health coverage and sustainable development goals. The four graphs on this slide highlight the critical impact of PHC. So first, we have the graph that shows us just how much reducing premature non-communicable disease burden and inequalities can be achieved when we strengthen primary health care. Or secondly, we have the graph on reducing healthcare, catastrophic healthcare payments. When we have strong primary healthcare systems, we can reduce catastrophic healthcare payments among the poor. Without strong primary healthcare, people are forced to seek care in hospitals or emergency rooms. This leads to higher out-of-pocket costs that push families into poverty. But primary healthcare can be made affordable, accessible services at the community level and reduce those unnecessary hospitalizations and that financial hardship. Or in the bottom left corner, we see how health outcomes should not depend on where someone lives or how much they earn. Yet gaps in healthcare access persist between urban and rural populations, socioeconomic groups, and marginalized communities. So PHC plays a key role in bridging these gaps by ensuring essential health services and preventative care and health promotion are reaching all communities in the rural and urban areas. And finally, the graph on the bottom right shows us that too many people are going without care because of cost, distance, or lack of available services. So strengthening primary health care expands community-based, patient-centered care, ensuring that mental health support, maternal and child health services, and chronic disease management are available where and when they are needed. So the evidence is clear. Investing in primary health care is the most effective way to improve health outcomes. It reduces costs and achieves UHC. Now, nurses, but effective primary health care is not delivered in isolation. And it relies on multidisciplinary teams working together to meet the diverse needs of populations. This collaborative approach ensures comprehensive, patient-centered care, addressing both clinical and non-clinical factors that can influence health outcomes. And here I want to emphasize just how important nurses are to connect as a connecting force in those multidisciplinary teams. So while PHC is built on multidisciplinary collaboration, it really depends on many different people. It's important to put the patient at the center and make sure that that patient's needs are understood by all the different health professionals. And that's a really important role that nurses can play, that all the health professionals are aware of the different information being collected by the different health professionals, that the nurse can also then help with expanding opportunities, recognizing where another health professional has not been included in the care of that patient and might be really important in the delivery of that care. So these are our primary healthcare competencies for nurses working in primary healthcare. And we did this quite a few years ago in 2019, and we did a literature review that really showed the different ways in which nurses can contribute to primary health care. So we've talked about patient advocacy and education. We've talked about effective communication, that the effective communication is between the professionals, but also with the patient. That they are coordinating and supporting teamwork and leadership for the different health professionals that are important to are most important at that given moment of time, but also that they are focused on a people-centered approach, that we don't lose sight of the patient's needs and that they are documenting those patient needs for the other health professionals. And finally, that nurses are pursuing continuous learning and research in these areas so that they are also at the top of their license and at the top of their competency range. So here's just another slide to convey that importance, that nurses can improve access to quality and timeliness of care by personalizing that care, by developing the care plans for our patients, by expanding the care, by increasing those opportunities of prevention or increasing those opportunities of treatment, or connecting care between health services and other sectors like social services or housing services or financial services, but also between the health professionals. And finally, to really monitor patients, that they're really understanding what they need and what everyone has tried to prescribe for them and take and the care that they've tried to provide them. The evidence is also very clear that nurses, in so doing, improve care. And we know from the evidence that emergencies can be managed sooner when our nurses are supported to do that work. We know that midwives can support 80% of normal births, because 80% of our births are normal and have been happening for hundreds and hundreds of years. But they need to be supported with education, regulation, and multidisciplinary teams to rely on, to connect with in case of emergencies, or to move the patient into more specialized care where it is actually needed. Midwives can avert more than 4 out of 5 maternal deaths, and nurses can complete approximately 70% of a general practitioner's workload, which means a general practitioner then can really work with more complicated patients, keeping them in the community without escalating them into emergency or hospital care. So here on this next slide, I wanted to say that nurses have always been at the forefront. This is not new. We've always been at the forefront of innovation. And we've been adapting to challenges with creativity and resilience as we navigate a rapidly changing healthcare landscape. Their ability to evolve and drive solutions remains central to strengthening primary healthcare. So let's look at some of these images. Here we see the emergency cart. In 1967, an emergency department nurse designed the first crash cart. It's now an essential tool during emergencies for life-saving equipment, much like today's primary healthcare nurses, who continuously adapt to new health challenges, who continuously identify ways in which we can optimize services in the community. We saw that in the kinds of digital health solutions that nurses identified during the pandemic response. Or perhaps our Florence Nightingale's ability and adaptability and evidence-based approach transformed healthcare during the Crimean War. So she revolutionized sanitation practices despite limited resources, and in a context where more people were dying in the hospital than actually on the battleground. So they were dying of infection. And Florence Nightingale found ways of introducing infection control and monitoring in those hospitals to improve the care that was developed in those hospitals. Primary healthcare nurses today mirror this problem-solving mindset. They utilize community health data to drive preventative care, manage non-communicable diseases, and promote health equity. If they are given that chance, they also can deal and work with that sort of data and evidence to improve those conditions. Or in 1954, the Danish health nurse Elise Sørensen responded to a patient's need by inventing the first adhesive stoma bag that you see on the bottom left of the screen. And this innovation empowered patients to live with dignity, just as primary healthcare nurses today develop patient-centered approaches, integrating mental health supports, community gardens here in Denmark for mental health patients, or chronic disease management and home-based care that is more responsive to patients' needs. So there are several such examples. We have the midwives in the UK who figured out that more daylight would help reduce jaundice of infants who are dying due to jaundice in their first hours of life. So nurses are still doing this and still driving this sort of change. We still see them in the driving seat. We see primary healthcare nurses in various ways improving health services. But we cannot rely on just a champion being individually competent or individually motivated. Our entire health system needs to support these health workers to really do the best that they can do. And this is why this is what was documented in the Time to Act report that we launched in 2022 that really showed that there are major threats to our health and care workforce. They're not receiving the proper investments in terms of their working conditions, fair remuneration, safeguarding their health and well-being, but also their education systems, strengthening their continuous professional development, building digital health competencies, or optimizing the performance, really engaging those nurses to be those case managers and to improve interactions with patients and promote appropriate use of digital technologies in those solutions. And finally, to plan and understand from the data what is happening to our health and care workforce and put money behind that planning, those investments towards building supply, retaining and recruiting, and optimizing performance. So these were some of those key messages that came out of the Time to Act report and resulted in that health and care workforce framework for action that was launched in Astana. But also previously, there has been a focus on specifically what are some of the issues that nurses and midwives face and that they need to strengthen their capacity. And we will see at the next May World Health Assembly, we will see the global strategic directions from 2020 revisited and discussed, and whether we will renew them. They will be based on the second State of the World's Nursing report that is going to also be launched on International Nurses Day on May 12th. And that body of evidence really shows where we are as a global community in strengthening nurses and midwives. What the last global strategic directions on nursing and midwifery said is that we really need to do better at supporting midwife and nurse graduates in their education, in their theoretical and practical training, but also the educators, so that they are nurses who are educating this next generation of nurses, and that they are equipped with the research skills, they are engaged in research networks, they are learning the newest methodologies on how to teach the next generation of nurses. And a second strategic directions is in the area of jobs and job security. So being 90% women, there's a lot of dynamics and issues that we need to address for the nursing and midwifery workforce so that we keep them, so they do not leave at the age of 50 to take care of their elderly parents, or miss career development opportunities because they leave the profession to bear children. So we have to think of solutions that support them to thrive, to advance in their career, and to get motivation from their career, but also to support their needs in their social lives and outside of work. We also want to see more focus on the leadership of nurses. So my position at the WHO is one of those examples where engaging nurses to be part of the leadership that supports other health programs to understand the value of nurses, but also to advance the priorities of nursing. And we want to see more nurses engaged in ministries of health, engaged in research as leaders on research in perhaps primary health care or some of the biggest challenges of our time. We want to not just have nurses deliver care, but actually lead some of the new solutions that we have for delivering that care. And in service delivery, we want to really see that nurses are able to work to their full extent of their practice. They are getting continuing professional development so that they can really work at the full scope of what we know nursing and midwifery can do in at the service level. So there are things that we may not need other health professionals to do, but nurses can already do some basic prescriptions or provide some of the disease management and triaging and referral systems that are needed based on their knowledge, but they can also initiate education. They can initiate health promotion without needing bureaucratic steps to block them from delivering those services. So here I want to just stop with this last picture of Polish nurses that really stepped up to the plate during the COVID-19 pandemic and created this hub where people could drive by and get tested for COVID. I mean, these are some of those solutions that where we see nurses educated, empowered, equipped with the tools, with the collegial support from their physician colleagues, from their midwifery colleagues, from their rehabilitation colleagues, where they're supported, they can really do a lot for our health systems because every health worker counts. It's time to act on supporting our health and care workforce. And moving forward, it's going to be very important to start thinking really outside of the box and moving the paradigm to a place where we're really focusing on every health and care worker's contribution to improving health outcomes. With that, I thank you very much for this opportunity to speak.